Hello, my name is Myra Alvarez, and I'm glad to be with you today to talk about the healthcare law, the Affordable Care Act, and what it means for you, your family, and your community. The first question most people have is, why did we need the healthcare law? The answer is that we had a health insurance market that worked very well for big insurance companies, but not so well for American families. Insurers could pick and choose who they gave coverage to, and premiums were skyrocketing, even as insurers made record profits. That's why Congress passed and the President signed the Affordable Care Act. Essentially, the law means four things for you and your family. It ends the worst insurance company abuses. It makes health insurance more affordable. It strengthens Medicare, and it provides better options for getting health coverage. Today, I'll talk a little more about each of these areas and make a few more key points about the law. The first way the law helps you is by putting in place some new consumer protections. In the past, insurance companies could take advantage of you. They could deny coverage to children who had asthma or were born with a heart defect. They could also put a lifetime cap on the amount of care they would pay for. So if you developed a serious condition like cancer or a rare blood disease, or you were injured in a car crash, your insurance could disappear right when you needed it most. And worst of all, they could cancel your coverage when you got sick just by finding an accidental mistake in your paperwork. Some insurance companies even use computer programs designed to search the records of people with breast cancer or HIV, looking for these errors. The law bans these abuses and more. As a result, 105 million Americans no longer have to worry about a lifetime cap on their benefits. Millions of Americans no longer have to fear their insurance being canceled without cause. And the parents of more than 17 million children with pre-existing conditions no longer have to worry that their children will be denied coverage. The second way the law helps you is by making health insurance more affordable. That starts with preventive care. We know that getting preventive care like cancer screenings and vaccines, it's one of the best ways to stay healthy. But in the past, too many Americans went without this care because their insurer didn't cover it, or it required expensive copays. When the choice was $50 for a mammogram or $50 for groceries, many women had to take their chances. Now, they don't have to take that risk. Thanks to the healthcare law, a wide range of recommended preventive services are available for free in all new plans. In 2011 alone, 54 million Americans got at least one free preventive service through their private health insurance plans. The law also helps you get more value for your healthcare premium. Before the law, some private insurance companies spent almost half of your premium on overhead, like marketing and CEO salaries, leaving as little as 60 cents of every premium dollar to spend on care. The healthcare law gets you more bang for your buck by creating the new 80-20 rule. In general, insurers must now spend at least 80% of your premium on healthcare services or improving care, or they have to repay the money. Because of this rule, 12 million Americans got over $1 billion in rebates from their insurance companies in the summer of 2012. That's an average of $151 per family. In addition, the healthcare law has put in place new rules that require insurance companies to publicly justify any rate increase of 10% or more. And we're already seeing these rules pay off across the country. Since the rate review program took effect in 2011, health insurers have proposed fewer double-digit rate increases. Health premiums are going up, but at a slower rate. And in some areas, premiums have actually gone down. Finally, the law makes health coverage more affordable for small business owners. Small businesses create 2 out of every 3 jobs. But in the old system, small businesses paid an average of 18% more for the same health coverage as the big companies down the street. That made it hard for small businesses to attract and keep the best employees. The healthcare law gives small businesses tax credits to help them afford coverage. Now, fewer small businesses have to choose between hiring and healthcare. In 2011 alone, about 360,000 employers who provide health insurance for 2 million workers received a tax credit. And it's important to note that no small business owner will be required to provide coverage under the law. The third way the law helps Americans is by providing new benefits for the nearly 50 million older Americans and Americans with disabilities who rely on Medicare each year. It makes many key preventive services available with no copay or deductible to help ensure that no senior has to skip a potentially life-saving cancer screening because they can't afford it. Already, 32 million people with Medicare have received a free preventive benefit. The law provides relief to people in the Medicare Part D prescription drug coverage gap, known as the donut hole. Now, those in the donut hole can get a 50% discount on their covered brand name medications, discounts that have saved seniors an average of more than $650 each, thanks to the law. And the donut hole will be closed in 2020. The law also provides a historic boost to efforts that crack down on Medicare fraud. These efforts help return a record $5.7 billion to the Medicare Trust Fund in 2010 and 2011. And Medicare's trustees say that the savings from improvements like reducing fraud will extend the life of the Medicare Trust Fund by 8 years. These improvements are strengthening Medicare for seniors today and tomorrow. If you have health insurance you like, that's what the law means for you. Protection from insurance company abuses, more affordable insurance, and a stronger Medicare. But many families and small business owners have coverage that doesn't meet their needs or will soon be too expensive. Others would like to get coverage but can't afford it. Millions are locked out of the market because of a pre-existing condition. The fourth key part of the law is providing Americans with better options for coverage. For years, young adults have had some of the highest rates of being uninsured. Most young people lost their family coverage when they graduated high school or college, and it was often a few years before they got a job that offered good health insurance. That meant that if they had a car accident or an unexpected diagnosis while uninsured, they or their families could go broke, trying to pay for the care they needed. Now, under the law, most young adults who can't get coverage through their jobs can stay on their parents' plans until age 26, a change that has already helped 3.1 million young adults get health coverage. The law has also provided new coverage options for Americans with pre-existing conditions. Under the old system, no one got a worse deal than the 129 million Americans with pre-existing conditions. When they tried to buy coverage on their own, insurance companies could hike their rates, carve out needed benefits, or lock them out of the insurance market altogether. For people with potentially fatal conditions like cancer, this meant they often couldn't afford life-saving treatments. The healthcare law has given Americans who've been locked out of the market a new coverage option. As a result, more than 70,000 Americans with serious health conditions are now getting the health insurance they need. And beginning in 2014, there will be better choices for all families and small business owners who buy their own coverage. Insurance companies will finally be prohibited from discriminating against people with pre-existing conditions or charging women more just because they're women. At the same time, every state will get a new marketplace for families and small business owners who buy their own health insurance. In these marketplaces, you can shop for health insurance and find a plan that fits your budget. You can even compare the premiums and out-of-pocket costs of plans in your area. And if you can't afford the premiums, you'll receive a tax credit that helps you pay for it. There will also be better access to Medicaid. States have significant flexibility in how these new marketplaces are set up. And no matter how they do it, members of Congress will get their coverage in the same marketplace too. What this all means is that no matter what happens to you, if you lose your job, change jobs, or you start a business, or you retire early, or you get sick, you'll still have affordable options for health insurance. And there's a couple more points to keep in mind. We all know that health insurance doesn't guarantee you'll get the care you need. In the past, you'd call up your doctor, and too often you'd hear that next appointment was in 4 months. Or you'd only see your doctor for 10 minutes because they had to rush on to their next patient. That's why the healthcare law also invests in training and placing thousands of new doctors and nurses in communities that need them most, and it creates and expands community health centers across the country. These investments will make it easier for you to see your doctor and spend more time with them. In addition, the law does not add a dime to the deficit. According to Congress's official independent scorekeeper, the Congressional Budget Office, the law is completely paid for through a wide range of reforms, from cracking down on healthcare fraud to ending wasteful subsidies to private insurance companies. So what does the law mean for you? 4 key things. It ends the worst insurance company abuses. It makes health insurance more affordable. It strengthens Medicare, and it provides better options for getting health coverage. The healthcare law is a work in progress, but it has already made huge improvements that will eventually touch every American family in some way. Whether or not you have insurance through the marketplace, you may think there's nothing to do until November, right? Not necessarily. Hi, I'm Myra Alvarez from the U.S. Department of Health and Human Services. Uninsured? With certain life events, you may be eligible to enroll for health insurance through the marketplace with a special enrollment period. What are life events that may allow you to participate in a special enrollment period? Think big. Getting married, having a baby, adopting a child, or placing a child for adoption or foster care, leaving incarceration, gaining citizenship, gaining or losing a dependent, moving out of the area served by your current marketplace health plan. Some other things that may qualify you for a special enrollment period are losing your health coverage because you aged off your parents' plan, you lost job-based coverage, you got divorced, graduated and lost student coverage, your income increased, making you no longer eligible for Medicaid, your COBRA coverage expired, or the end of your policy plan year was in 2014. It's important to know that voluntarily ending insurance coverage does not qualify you for a special enrollment period. After you go online or phone the Marketplace call center and let the Marketplace know about your life event, you'll receive an eligibility notice that will let you know whether you qualify for a special enrollment period. If you are eligible for a special enrollment period, in most cases, you have 60 days from the triggering life event to enroll, so it's important to quickly report the life event. If you currently have health insurance from the Marketplace and experience certain life changes, you need to let the Marketplace know, because you may be eligible to save some money or switch to a new plan, which may work better for you. Also, you may reduce your tax credit amount, ensuring you are not liable for excess tax credits when filing your taxes. And with a life change, you may even be eligible to gain coverage through Medicaid or CHIP, the Children's Health Insurance Program. So what do we mean by life changes? Things like becoming pregnant, getting a new job or other change in income, a change in your tax filing status, gaining coverage through your job or a program like Medicare or Medicaid, changing your name, social security number, citizenship, immigration status, or your tribal status for American Indians and Alaska Natives.